I have two parts to my presentation today. The first is a 3-slide update on where we are with the COVID-19 pandemic. And then I want to just talk briefly about MCW's experience with COVID-19 and managing our workforce and our other stakeholders. So if I could go to the first slide, Chris. Most of our indicators are trending slowly, unfavorably, and maybe moving unfavorable a little bit faster the last 10 days or so than we'd seen in the previous 2 months. So you can see we're averaging well over 1,000 cases per day. And please note there is a mistake on this slide. Under the 1767 7-day average, yesterday we actually had 1,087 reported, not 236, so I apologize about that. And the numbers are trending upward. We're probably underestimating the case counts because our positivity rate is substantially over 5% and climbing, and that's not surprising. After a little over 2 years, people know a lot more about COVID. There are readily available high-quality at-home test kits, and people just may be quarantining or self-isolating based on the kit availability, and those do not get factored into the numbers that are reported by the Department of Health Services. We know that we're moving in the wrong direction because the reproductive number is greater than 1. It's actually been greater than 1 now for about 8 weeks. And you can see on the bottom, the Milwaukee numbers reflect similar trends, the average of 335 cases per day with almost 400 yesterday, 12.3% positivity rate, and are exceeding 1. We also know if you look at county level data and use the CDC risk calculator for the risk of contracting COVID-19 from incidental contact with other individuals indoors, a number of our counties moved from low risk to medium risk, and many of the low risk counties are trending toward that medium level of risk. Next slide, please. On this next slide, I'm going to talk a little bit about deaths and hospitalizations. Thank you, Chris. We still have just single-digit deaths being reported in Wisconsin, and there is some variability in the numbers that are reported. So it's difficult right now to say that there is a trend. It appears to be relatively flat to possibly unfavorable. And because the case numbers started to visibly tick upward about 2 weeks ago, really wouldn't expect the deaths to start being measurably increased until maybe another week or 2 down the road. So we'll be watching that carefully. Hospitalizations also are going up, but they're still relatively low. 288 total hospitalizations with COVID in Wisconsin and 40 in our intensive care units. Totally manageable. We can take care of people regardless of whether they have COVID or not right now, but the numbers are moving slowly in the wrong direction. Our ICUs are running at a little over the optimal operating number at about 85.6%. We'd like that to be closer to 75 to 80%, but plenty of capacity available. And the same for hospital beds. Typically, you want to be in the 80 to 85% range, and we're running at 88, much better than we were running in January and even in early February of this year. And here in southeastern Wisconsin, only 21 ICU beds used, and the trends right now appear to be flat. So all in all, we're a very manageable place with the COVID-19 pandemic. Would ask people, though, to continue to practice some mitigation measures based on whether they're indoors and interacting with large numbers of people, because folks are taking the masks off and we're congregating more than we were even a few months ago. And COVID-19 is still with us. And the Omicron sublineages that are emerging are clearly more contagious, and they're getting more and more contagious. So if I go to the next slide, just looking forward, people are asking, what's going to happen in the next month? And the honest answer is we don't know. If you look to Europe, there's huge variability in the pandemic burdens in many of the countries, even countries next to each other. So, for example, the United Kingdom never saw a full recovery from their January surge, and they had a pretty significant uptick here with BA2. Although now they're trending favorably, and they basically have no public policy mitigations. They're wide open. Spain, on the other hand, with a very high vaccination rate, never had that second surge. And they're watching carefully, but it doesn't look like they're going to have the emergence of a wavelet or a mini surge anytime in the near future. Germany really never recovered from their Delta and Omicron waves. You can see they had a little tiny uptick from BA2. There may be some BA4 and 5 mixed in there, but they're still at a very high community transmission rate. And then you look at the US, and as I said, for about the last 8 weeks, we've had a slow rise. It was steady until about 10 days ago, and now we can see in some states a clear uptick, but I would call it a wavelet or a mini surge, and not necessarily the kind of surges that we saw earlier, and we hope that that trend will continue that way. So I'd like to pivot to talk a little bit about MCW's experience during COVID-19. First of all, I just want to remind everybody, we're a large company. We have $1.3 billion of revenue. We have over 6,000 employees. We're the 7th largest employer in the Milwaukee metro area. And we've got about 3,000 learners on our campus. And literally many thousands of people come into our business settings on a daily basis. So I'll just start by saying it was a lot easier for us to know the right things to do at the beginning of the pandemic than it is now when we're trying to establish a new normal. So at MCW, from in January, actually, of 2020, before we even had the first case of COVID in Wisconsin, I established a task force of infectious disease experts, epidemiologists, clinical and education leaders, people that represented our core business functions and our community stakeholders to try to prepare for what we thought might be some challenges that could emerge in 2020. And I also want to point out that we are an educational institution primarily, but we are physically connected to Froedtert Health through skywalks and to Children's Wisconsin through tunnels. And that we literally have thousands of transits back and forth every day between the office and education space at MCW and the frontline healthcare environments at Children's and Froedtert. And we had to factor that in. Also, many of you may not know that almost all healthcare provided at Froedtert Memorial Lutheran and greater than 95% of the healthcare at Children's is by MCW employed physicians. So there is a lot of back and forth. So what did we do? We've been conservative. We have required vaccination for all of our employees because we really couldn't draw the line of gradation between frontline healthcare providers and people that were isolated from the healthcare environment because of the physical connectedness of our organizations. We have, from very early in the pandemic, required masks for everyone on campus. That's going to change June 6th, and I'll talk a little bit more about the cadence and the thinking that went into that. And we did choose June 6th really to jive with our commencement activities, particularly here in Milwaukee. We're going to have literally thousands of people in the Milwaukee theater, and we're going to have over 100 of our 50-year grads from the last 3 classes that are going to be in the facility, and many of them are octogenarians. And we had told people that we were going to enforce masks at the event, and many are planning to come from all over the country. So we did not want to pivot at the last minute. And so all of our commencement events will be over as of June 6th. Our policies have largely been accepted by our employees. There are some dissenters, as you would expect, with so many people working here and in an academic environment. The dissenting voices have become louder and more insistent over the last few months. Probably not a surprise. This is a polarizing issue. That's something that I had to factor in as a leader of our organization. The next slide, please. So I want to dig a little deeper. In March of 2020, as I said, it was pretty easy to know what to do. We had prepared to protect our core business functions and move them off-site into hybrid and virtual work environments. We pivoted very quickly and very effectively, but we also had to do the same thing for our learners and for clinical care. We restricted access to our campuses only to business essentiality. for the roles. We really had a lot of people start working from home who had never done that before. We mandated face masks and distancing. We stopped food service within our facilities, at least early in the pandemic, when there was concern that there may be foodborne transmission of COVID-19. We limited our room capacity to 1/3 of the posted capacity, and that correlated pretty well with the 6-foot social distancing guidelines that the CDC was talking about. We also paid very special attention to optimizing our HVAC and the traffic flows within our facilities. We did suspend non-essential healthcare. That was not our decision. That was a decision by Health and Human Services imposed on all healthcare organizations, which posed a lot of challenges for us. We had to pivot to virtual clinical care settings for non-critical healthcare services. We stopped university-sponsored in-person events. Many of our big fundraisers were scheduled for that part of the year, and we had to cancel. And we had huge financial challenges associated with the suspension of non-critical healthcare. Fortunately, in May of 2020, some in-person clinical care was restored, and we did not at the time, in retrospect, have huge burdens of COVID-19 that were overwhelming our healthcare facilities, at least not in mid-2020. Next slide, please. We did have to furlough employees, over 700 people, such a hard decision for us to make, but we went from projecting a $40 million revenues in excess of expenses for that fiscal year to projecting a potential $100 to $125 million loss. So we had some very severe financial mitigations that we needed to implement extraordinarily quickly. So furloughs were part of that. We did pledge to our employees that we would do everything possible to bring them back to work within 3 months to preserve jobs, and we did a pretty good job of that. Most of our people did come back, but we had other financial mitigations, salary withholds for everyone, with a sliding scale, with the largest burden being assumed by the people at the high end of the earnings scale. And we had travel restrictions. For people that were on incentive comp, we withheld those incentives. We were eventually able to restore a large part of those as part of our financial recovery, but it was really a pretty frightening and challenging time for us there in the early months of the pandemic. In September of 2020, we did restore limited food service, single-serve packaging. In limited amounts, we allowed individuals from behind plexiglass shields to serve to our people, but we did not have buffets and open service. We did return most of our furloughed employees. And in December 2020, we stood up one of 9 Pfizer vaccine sites throughout the state of Wisconsin. And this was an all-volunteer effort in our education space in the hub building at MCW. And MCW does not operate clinics. Those are done by Freighter and by Children's. So this was a huge lift for us. Hundreds of MCW faculty, staff, and learners participated in this clinic. We gave 20,000 doses out. We believe we did this equitably. We were one of the first and only healthcare providers that reached out to non-affiliated providers in the community and offered vaccinations to them. Many of the other sites focused primarily on their employees. We also reached into communities of color to make sure that we were equitably distributing that very precious resource in the early months of the pandemic. As we got into April and recognized that the availability of the Pfizer and Moderna vaccines was better, and that the vaccines were less fragile than we thought they could be, we knew that there were more sites that could do a better job of administering the vaccines. Then in July 2021, we made a very difficult decision to require mandatory vaccination for all of our employees and learners. The rationale was that we were taking care of some of the most vulnerable people in our communities, that they expected a higher standard from us as healthcare providers than they might from MCW as an educational institution, and that we really were having extraordinary difficulty deciding who was a healthcare provider and who wasn't, because our people interacted frequently with each other in the healthcare settings and also in MCW education spaces. That was hard. We lost about 60 employees. Most of them were part-time casual workers, but we lost some that were business essential, in particular in our animal facilities and vivarium. We lost a lot of our animal caretakers, and it posed a real challenge for us. None of our frontline healthcare providers left the organization because of the vaccine mandates, but it was painful. Some of our longstanding employees who were doing valuable work left because of that vaccine mandate. We also had a robust exemption process and had about 100 out of our 8,000 stakeholders receive exemptions, and most of those still have chosen not to be vaccinated. If I go to the next slide, please. In April of 2022, we increased our room capacity to 50% of the posted capacity as we came out of the Omicron wave. We restored limited on-campus job interviews. And if you think about it, as a large employer, it was very difficult for us to hire a workforce without actually bringing them to campus, because we, like many of the large businesses in the region, recruit nationally. In May 2022, we started allowing plated food, not buffets yet, but we increased our room capacity to 100% of the posted capacity. And then looking forward in June, on June 6th, we'll highly recommend but not require masks, except for our 100 or so unvaccinated individuals who will be required to wear high quality masks. And that means no cloth masks, either KF94s, N95s, or surgical masks on our campus. On-campus interviews will be allowed. We'll bring visiting professors to campus to give in-person presentations. Outside visitors and family members can come to campus, and we will allow outside organizations to use our facilities. And we're really happy to do that, because we believe that we should share our wealth and with our communities, and that includes our physical facilities. And we will allow buffet food starting in June. Next slide, please. So this is complicated. We tried to communicate consistently. The task force was challenged to provide clear communications that were packed with the necessary information, especially when you're in an academic environment where people want to know what the science is and how you made the decision and who made the decision. This is just a tiny slice of the matrix that we posted for our department administrators. And as you can see, it's complicated, and it wasn't anything easily translated to busy workforce. So that was a challenge for us. If I could go to the next slide, please. We tried to simplify things by providing graphical timelines, but even just looking at this, it doesn't capture all of the decisions that we made over this 3 or 4 month stretch here in the second quarter of 2022. So I want to circle back to the communication challenges that we've all had, and that maybe more than anything else has been and will continue to be our most daunting challenge. If I could go to the next and last slide. I just want to talk a little bit about just some factors to consider. Everybody has a unique circumstance. They need to balance a lot of things, that the needs of their customers and how they interact with them. The same with the employees, balancing the safety of vulnerable individuals with the desire of people to be interacting with each other face to face, how frequently people interact for your core business functions, the physical layout of your workspace, ventilation. What is the feasibility of actually reducing the workplace density? So if you worked in a chicken processing plant or a meat processing plant, you can't reduce the density. It's just not possible. For example, your culture, what will it accommodate? The connectivity and engagement and how important that is. And one of the things we learned throughout the pandemic is our students were lonely, our faculty and staff providers were feeling isolated and under huge stress, and they missed being able to interact with each other. And then trying to reinvent your organization and consider whether virtual and hybrid options are part of your future. I would say at MCW they are. We were planning to spend $50 million on a parking deck. We may not have to do that now because a significant portion of our workforce is coming in part-time, or they're working entirely from their homes. And so my pitch to our people is, I'd rather spend that $50 million on people and programs than on a parking deck or a building. So if I can go to the next slide. These are the data sources that we use, and I just want to say thank you so much for your attention, and thanks to the MMAC for being a really good partner in trying to really maneuver over the last couple of years through this difficult interface between the economy and health. Chris, I'll turn it back over to you.
Yeah, Dr. Raymond, we appreciate your leadership during this time as well. And I think it's interesting to hear you run through this, because in this context here, we think of you as sort of the scientist and expert who's walking us through the worldwide and nationwide, statewide, and county responses, but also you're wearing the employer hat. And how challenging has that aspect been for you? It sounds like very challenging.
Yes, it is challenging, and it's going to continue to be. Right. And, especially now with people being fatigued, with messages being overinterpreted, maybe not in the right way from the CDC about the risk calculator, that people really want to get back together. And again, we're weighing that with the fact that more and more contagious variants are emerging. We in the US do not have good uptake either of completion of the first course of the vaccines, and especially the boosters. We are lagging way behind other developed countries, and only a third of our people have gotten boosted. And we're seeing a growing challenge now with people that were vaccinated with a full course of vaccine but not a booster, starting to have diminishing protection from COVID-19. And if you look at the Omicron surge, and there was an article in the Journal Sentinel just last week about this, the difference between vaccinated and unvaccinated in terms of bad outcomes, so hospitalizations and death, is shrinking over time. And so if you want to get that 10 to 20-fold protection, that reduction in your likelihood of death, really now it's the time, if you're not boosted, to get a booster.
That's a great point. A good question from the audience here. Will a significant uptick in cases change your plans to loosen restrictions?
They might, but I think, at this point in the pandemic, and MCW's tried hard to not weigh in on policy decisions, other than our own. I think we really do need to pivot more to personal responsibility than mandates. Obviously, employers in certain sectors may need to really react more quickly to an uptick, and again, healthcare would be one. But again, even though we've been very stringent, and I'm personally very conservative and have actually been criticized by some of our people for that, I do think it's time to try to educate people, depoliticize the conversation about masks. Look, they work. They work if people wear them properly, and enough people wear them. They're not perfect. They're not an impervious barrier, but they're a pretty good layer. But pivoting to personal responsibility, in my opinion, is where we're going to need to be for the remainder of the pandemic.
Got another question from the audience about the arrival of summer festival season and concerts and sports games to go to and all these great things that we love so much here in our community. It's real simple. What should people do? And I know that's a hard question to answer, but I think it's what everybody wants to know.
Assess your own personal level of comfort with the risk. So the risk of outdoor activities is low, but it's not zero. And if you're crowded in a queue to get your fried donut, fried dough at the state fair, or your cream puffs, you might want to put a mask on, even if you're outdoors. If you're at the Pfizer Forum for the next Bucks victory, which I know we need and will happen, you might want to wear a mask, especially if you are not boosted and you're in a vulnerable population. But again, that's a personal choice. And it is time for us to resume some semblance of interaction with each other in the workplace and socially, and we recognize that. But again, it just gets back not just to personal responsibility, but personal choice about what risks you want to take.
Yeah, a couple minutes left here. Question, I've heard you talk a little bit about potential reformulation for vaccines, either this fall for new strains or somewhere down the road to attack what you call the ball of the coronavirus. Could you go through that a little bit?
Yeah, thank you, Chris. This is really important. We're lucky that, first of all, that we had mRNA technology that was available, because these vaccines with mRNA technology have proven to be better than the more traditional vaccines. But they were raised with a virus that was circulating in early January of 2020. That virus isn't circulating anymore. COVID-19 has gone through many mutations, many more difficult lineages have emerged, and it's continuing to mutate. So at some point, the protection that we get from the spike protein vaccines isn't going to be what we need, and we're already seeing some diminishing protection. So for this fall, I hope that the vaccine manufacturers will do what we do every year for the flu shot, which is to reformulate the antigen, not change any of the other ingredients, but the sequence of the protein. This shouldn't cause alarm. People shouldn't be talking about huge risks. We do this every year with the flu shot. We can do the same thing with COVID-19. That would be with the spike protein. The problem with the spike protein, though, is it changes. It's a hypervariable region of the virus. There are other parts of the virus that don't change very much. So as you said, the ball or the capsid of COVID-19 doesn't mutate very much. And the spike proteins are stuck to that ball. So if we could raise antibodies that work against that capsule, maybe we could get more durable immunity and we wouldn't have to change the formulation very much. That isn't feasible to do this year, but I'm hoping next year that the vaccines that are available will be hybrids using the spike protein and also the capsule.
Excellent. Thank you so much for your time and your perspective on this, Dr. Raymond. And thank you for being so transparent with the process you've gone through at the medical college. I know it has not been easy, but we do appreciate your leadership on several fronts.
Yeah, thank you.
Thanks everybody for attending today. Have a great afternoon.